Hello, everyone. Welcome to the Lungleng Show. Today, we will be talking about mental health. We all know that mental health is being talked about everywhere nowadays, but we do not understand what it really means. What is really mental health, and we do not know what are the causes and how it can be treated. Because this kind of mental health is something, mental illness is totally different from other sort of sicknesses. So it requires us to dwell a little bit more into detail into this topic, and we all understand the importance of this and the nitty-gritty of this. So joining me is Dr. Ayangla Longchar on my right, and she's a medical officer at the State Mental Health Institute, Kohima, and she is also a consultant psychiatrist at the Tele cell in Nagaland. So she's based in Kohima. Thanks for joining in this conversation.
Thank you, Lungleng, for having us.
Great. And on my left is, I call her Suyim, but that's her short name, but her full name is Suyimtenla Jamir. She's a psychologist, and she also works for Tele cell here in Nagaland for the state government. Yeah. So thank you so much for joining in this conversation.
Thank you for having us.
We all know that this is going to be a very important conversation as to, people would love, at the same time, I would love to hear your experience on how you're dealing with mental health and people who are suffering from mental health. There are people saying that mental health is just your mind, and the moment you stop worrying, the moment you stop thinking too much about things, mental illness can just go away. That's what normal people think. That's people who don't understand the nuances of mental health, mental issue, mental illness think. For that purpose, I want to understand better from you guys. And since you have been working here for the last 4 years, you have been working for 4 years, right?
Yeah.
So can you tell me what is Tele cell?
Tele cell is a telepsychiatry this thing for teleconsultations, where like the patients or the people who are mentally ill can contact, like even from the rural areas also, from the interior areas of Nagaland, and through online consultation we can give some ideas, or whenever they're stressed they can call us, and then we can give some ideas, some coping strategies, and then even it's very good in our state also. Why? Because of the stigma, because of the lack of psychiatrists or psychologists everywhere in every state of Nagaland. So it's very difficult for them to come and approach us, even because of the economic issues, right? So through phone, everyone has a phone these days. Okay. So through phone, they can just call on the, we have a number, right? 14416. Yeah. So it's a number they can call us anytime, like from 24/7. As of now, we have it functions from 10 to 5, but
9 a.m. to 5.
9 a.m. to 5 p.m.
Yeah. So in the next 1 month from August, we're planning to make it 24/7.
Oh.
Yeah. So
we're hoping to give services 24/7.
Okay.
So so just to add on to what Dr. Ayang has just said, Telemanas, basically it's the digital arm of the National Mental Health Program.
Okay.
Now, the National Mental Health Program is specifically targeted towards servicing, people with mental illnesses across India. Now, this program was launched in the hope that, far-flung places would also be reached in providing services. Also, there will be equitable service, quality service. So in accordance to that, in 2016-2017, NMHP was launched here in Nagaland.
Okay.
It was the directive by Government of India. Then after that, it has slowly started to progress. We have about 11 or 12 DMHPs. That is the district mental health programs.
Okay.
So under NMHP is DMHPs.
Right.
So,
but we have very less psychiatrists,
very
right?
less.
Yeah.
In the district level, you have psychiatrists?
Yeah, a couple.
A couple of us.
I think overall psychiatrists, I think about 16, 17, I don't know. I don't want to give like
a
rough estimate. Okay.
In the whole state?
Yeah. The whole of Nagaland, yeah.
Oh, and you are one of them.
Yeah, she's
one
part
of
of
them.
the
And
team.
how about you? You're no psychologist.
A working psychologist. We have several. We have several working in different capacities, in different programs in the Directorate of Health and Family Welfare. So psychologists, so we do have. However, I think the things that we have to do, or the work that we have to do, I think we have protocols are yet to be made. So I think we're a little in the gray area again, considering work-wise. So again, coming back to the Telemanas, it's Tele Mental Health Assistance and Networking across states. So 2023 is when we launched. We had 2 months of trial before launching. And August, finally, we started the program full swing.
So it's a national program, funded by government of India. But did people really call?
Yeah, they do.
I don't want you to disclose them, but at least.
Yeah, I mean, it is for the state, so the state should know the data, right? So calls are not that high. In a week, we have about 3 to 4 to 5 average calls.
That is because we have not yet focus on the IEC part.
Yes, without much sensitization, they won't call. Now, maybe after our conversation here, you might be
Hopefully,
getting more calls.
Hopefully, that's what we're hoping as well.
So, one thing I want to know in Telemana cell, who are being seated there to take the calls? Psychologists, like counselors?
There are some counselors that have been, kept to attend the calls. They usually do the first aid, they attend the calls, and then if needed be, then they refer it to the psychologist.
Makes sense.
And then after that, they refer it to us, the psychiatrist. Yeah.
Okay. Well, that's interesting.
Yeah. So we have two-tier system. So the first tier is what Dr. Ayang was referring to, the counselors who stay in a rotational shift from 9 to 5. And they're available during that time to take calls. And if cases are quite severe or require some kind of psychological assessment, then it will be transferred on to the psychologist.
Right.
We also have a social worker. So both of us will discuss the case, or will try to handle the case. If it becomes a pretty severe case, then we then pass it on to the consultants who are in the tier 2. So they're the tier 2. Yeah.
You call them to the, the
and if they're in a very far-flung area, we find out what is the nearest DMHP to them. So District Mental Health Program, and then we start connecting cases.
This is a nice service, and people should make use of it. And now people who call in, well and good, but what do they normally say? I mean, just in very generic, what do they normally say? They would say, "Hi, I'm suffering from, I'm so worried about things. I have anxiety." Or what do they normally say, people who call in?
Yeah, it's you can think of Telemanas as calling your friend. So how you would call your friend normally, and then
so they don't have to say, "Hi, I'm so worried and I'm so anxious right now."
You can start with
now,
anything.
I feel it's mostly exam stress.
Yeah,
they have called mainly
students.
Students.
Relationship issues.
Relationship issues.
Even parent and child relationship issues.
Probably.
It's interesting.
Absolutely.
Yeah.
As of now, that is what we have got, mainly because we haven't focused on the IEC part.
Yeah.
So it was launched last year.
Yeah.
And
August
29,
and still it's very good, even though you have not done much on IEC, that means advertisements and sensitization about this, still people are calling in. So that's a good progress.
Of course.
Right? And people are making use of it, which is beautiful. In one sentence, what is mental illness to you? What is mental illness to you? Just in one sentence.
Mental illness or mental health?
Let's say mental illness.
Okay, mental illness. I feel it is a range of disorders, right? Which has got to do with disruptions in our behavior, disruptions in the emotions and the mind. That is what I feel. The thought process.
By some external factors.
Of course. There are so many factors.
Right.
So
can it be from personal factor internally as well?
It can be, the first of all that we focus on as a psychiatrist is the biological factors. Right. That has got to do with the neurotransmitters, dysfunction, disruption of neurotransmitters.
Biopsychological
Yeah,
part of it.
of course. And next comes the social factors, the environmental factors.
Yeah.
And then, as you said,
Socioeconomic, factors, all of that comes in this.
Okay, well, now that's interesting. Let's leave it there for
it's
now.
multifactorial.
Yeah.
It's
Multifactorial.
multifactorial, fine. So from a biological factor, what are the main or biggest factors that's responsible for people falling ill mentally? Like biological factors, how can it be biological?
See, biological, when we see it has got to do with a lot with the genetic factors also.
Okay.
Right? And biological factors, if you say it's because of the disruption or dysregulation of the neurotransmitters. So the neurotransmitters, I'm sure many people must be knowing those are the serotonin levels.
Okay.
Yeah, and the norepinephrine, right? And then the dopamine.
In layman's, we'd call it hormones.
Of course, yeah.
So to understand a little bit more better, it does sometimes some people suffer mental illness, not necessarily because of whatever is happening in the environment, or whether it may be he or she may be from a good family background, very peaceful background, socially, economically well-to-do, everything taken care of, but still he or she can suffer from mental illness due to biological factors. Are you saying that?
Yeah, that is what I say.
Okay.
Genetic factors.
Wow.
Yeah. So genetic factors, thus leading to
50%
disruption
we
of
look at genetic factors as well. We see if there's a history of mental illnesses in the family.
In the family.
So that leads to predisposition. And then if there's predisposition and the environment is just right, there's a higher chance of mental illness
Environment
developing.
exacerbates the biological factors again, right?
Of course.
So from the socioeconomic point of view, or let's say from the external factors, which is not biological, how can someone become vulnerable to mental illness through, what kind of factors are risky so that people fall into such illness? What kind of factors are risky externally?
A very wide range of things, I
feel
suppose.
like starting from the first start, I would say ki childhood trauma contributes
trauma.
a lot.
Just about
Starting
to
from
go
the
there.
first,
Trauma, abuse, right?
and then bullying because
bullying
childhood
and all
trauma.
that. Plus, of course, there's also personality
Parental conflicts.
Yeah, parenting conflicts and personality traits. Also, sometimes, when there is a clique or a crowd that you want to get involved with, and you're not able to adjust properly, then there might be some issues there as well. All of these, like Dr. Ayang has said, also biological. It doesn't mean it's purely biological. There's always an interconnection with all of the levels.
Of course. It's not independent that since you have chosen biological, I have to go. It's not a sudden choice, right?
Yeah, so I keep telling this to my interns also, like there's always transference of data from the environment to us, and we sort of interpret that data, and then we translate it out from our behaviors, our non-verbal cues, and how we adjust to certain scenarios or situations. So you should really be aware of what data you're taking in from the environment also. So I think that's something to
in psychiatry we call it as epigenetics.
Okay.
There is a term called epigenetics. So it has got of course the gene part also comes in, but the environmental factors around the the person who are affected, that assembles everything.
Okay. So these are happening among people regardless of age, right?
I mean,
of course, infants, they would not have such things as mental illness.
Of course,
so it comes along with the growth of our cortex brain, right? Without that, we would not. We would not bother much about what's happening around us.
Prefrontal cortex.
Okay, yes. Okay. So children or infants do not have that fully grown prefrontal cortex, whatever. Infants don't have that because they need to grow a little bit more, right? So without having that, then can mental illness come into people's life? Suppose, let's say we are talking about, how people are suffering because of the environment, because of the cares and concerns that they have for their family and the childhood trauma. Suppose someone is, I don't know what would be the right word to say this. A child is, let's say, mentally different. I mean, he's not able to understand, comprehend what's going on around the world.
Okay.
Like,
some neurodevelopmental disorder. Yeah.
You would know that technical word better. So let's say a child is suffering from that, and he's not able to comprehend what's going on around his environment.
Okay.
And although he has been abused, molested, he doesn't realize that he has been, and he's not able to comprehend that he has been done wrong. So he wouldn't have that trauma.
Of course.
He wouldn't realize. He wouldn't remember that. So do they suffer such kind of mental illness?
Of course they do.
They do also? Without realization also?
Yeah, without realization also, because neurodevelopmental disorders also, if we go to the the intellectual disability, so to say, in particular, right? So they have like mild, moderate, and severe, and very severe. So most probably, like if they are very severe, then they'll eventually have some behavioral disturbances. Why? Because they're not being able to, comprehend anything. They'll have comprehension issues,
right.
not being able to communicate, so their way of communicating will be different. So all those disruptions in behavior will come out because of that. And if you go to the mild intellectual disability, then of course what they have is like they don't have issues with comprehension. But the thing is that the reasoning, there is a problem with the reasoning. So eventually they perceive whatever they, whatever they sense, they perceive. So eventually they're not being able to understand. So when those things comes, they are the most afflicted, I suppose. And what we have seen is that in those people or those category of mild intellectual disability persons, they are the most inflicted with depression.
Because they can't express.
They cannot express, moreover, and it's mainly because of the perception.
Yeah, mainly because of the perception. I think I can follow that up with a recent case.
Okay.
So a child of 15, 16, she has mild IQ disability, and she now has selective mutism as well. She refuses to talk to individuals who are strangers, or she categorizes as strangers, right? We all have our own category of who we call strangers. So, the first session was very interesting because she ended up non-verbally communicating with me by writing down.
Okay.
And she said, I don't like the way people look at me. So they do comprehend at some level that there is some difference in the way they're translating information and they're putting it out there, and that people are not receiving it in the way they want it. So that disruption can really lead to an emotional imbalance. And now as they're growing older and their developmental qualities are not catching up to the age, biologically, physiologically, socially, psychologically, not catching up. So there can be a lot of friction in themselves as well. I am here, but I'm not really here. I'm not at this point yet.
They suffer with a lot of low self-esteem as such.
They do as well. Yeah. So it was a very interesting time with the client as well.
Okay.
We are in our third or fourth session now, and she's slowly verbally communicating. Okay. Even though the communication range is not that wide, she can say, "I don't like this. I like this," which I'm happy about.
Okay.
Because at least she's able to say individually,
This is
something that I like. This is something that I don't like.
And she didn't say that before.
Yeah, she was not explaining, or she was not even verbally telling me those things. So I think,
that's interesting. And then, does it have to do with people who are introvert as well as extrovert? Or is there a data that shows that people who are introverts suffer more from mental illness? Or is there a data that shows that people who are extrovert don't suffer much more from?
I think it goes to externalization and internalization. Yeah.
Okay.
So
bit closer.
Okay.
That's okay.
So people, those who are introverted, they internalize their emotions more.
Oh, right. Okay.
Yeah, so they don't express much. They tend to overthink.
Yeah.
Right. So overthinking eventually leads to anxiety because there is so much conflict in between their thinking, what they think, what people perceive, and they have this thing. What I feel it has got to do with a lot of what people think about them.
Yeah.
Too.
Yeah. Others' opinion.
Yeah, somewhat like that.
Yeah.
Yeah. So I
It's a
think
very,
that
yeah.
also
Nice.
contributes. Yeah.
Personality traits are a very hot topic
Okay.
amongst professionals as well.
Yeah, so
I would agree with that,
as
yes.
rightly pointed out, personality. We have so many personalities, right?
Of course.
So we have cluster A, cluster B, cluster C. If you
Yeah.
can cluster them together, of course, it has so many characterization. But
Yeah.
then, like cluster A, all the clusters have different personalities. So even these personalities also, like they contribute to how they react to things, how they perceive things. So accordingly, even I think mental issues also come
Yeah,
about.
Oh, okay.
A lot of
Yeah.
I think
things
that's
that go
very
into
interesting.
Yeah.
Internalization, and that's very true. Okay, for people who are introvert, sometimes there are people who are very smart and introvert, but they don't expose themselves much. They don't come out themselves much in the public. But in themselves, their thinking process has gone beyond many people. I mean,
course.
the normal range of
Of
their
Yeah.
thinking capacity. And they end up just internalizing and caring what others would think about me. If I say
Right.
this, that's why they end up not saying things. But when they start writing, that's why I think people who are suffering from this and people who are, let's say, introvert, a lot of people become good writers.
Of course, yeah.
Yeah.
So
That's
writing is also a good coping mechanism.
it's a
That is
very
what
good-
we say.
yeah.
Yeah.
It's a very
so
good coping
eventually,
strategy.
yeah. So whenever like we feel like people are introverted and they are in depression, we usually tell them ki they have trust issues also. That is what we have seen. So eventually we tell them ki why don't you invest your time in journal writing so that you don't think much. Nah? So that is also a good
Yeah,
coping
yeah.
mechanism
Right,
actually
right.
Yeah, just a
to
quick
help them.
tip on
Wow.
that
Yeah.
journaling
For
part.
rehabilitation,
Yeah, for
yeah.
rehabilitation, yeah. So a quick tip on that journaling part. We don't just mean like write, keep writing.
Yeah.
We sometimes we have this. You keep a track of the emotions that you're feeling throughout the day. And maybe a reasoning to why that emotion is there. So you have like an emotion journal. Like instead of just a thought journal, so
Right.
you have a certain emotion journal. And there are different kinds of journaling. So we kind of specify according to how the individual would be able to write the journal. We give certain tips like that to write down the journals. So it's not just random writing down of
It's more about emotional processing.
processing, EQ enhancement,
So when it comes to mental health and mental illness, and psychology and psychiatry, you call it psychiatry?
Psychiatry, yeah.
Psychiatry.
Yeah.
I have read some documents or papers from American Psychology Association. It's a big association, and I think it's one of the most, let's say, credible organizations when it comes to mental health,
Of
right?
course, yeah.
They are There are people full of researchers and full of practitioners, counselors, and who writes papers and who do a lot of researches. And I think the fact and the reality comes out when we do researches. And so I believe whatever papers they have published, it's of good quality content. And I'm sure you must be reading some of their papers as well. Whatever they define in their papers, for example, or any psychologist or any mental health practitioners or professionals, whatever they research and find out there in their country, can we relate their findings here in our context as well?
not 100%.
Yeah,
Not the
Not
external
100%.
factors, but at least as a human being, when it comes to mind and mental state.
of course.
Because the external context
Right.
external factors will be different.
Very
Our
different,
society is
yeah.
different, theirs is different.
Yeah.
Theirs is very independent society, very individualistic. Ours is like communitized. Whatever you do, since you have come you both have come on my show, now your family people who are connected to you will start talking about you. But out there, it's very individualistic. Like people live.
Yeah, autonomy is very important
Yeah.
for them. Nah.
Yeah.
Yeah.
So what I want to understand is whatever they understand, whatever they find out there, do we have relevance as a person, as a human being in our mental state?
What I feel, there's researchers on the anatomy of the brain will almost be the same.
Of course.
But the external factors will be a bit different.
Okay.
Because what I feel, they have a more individualistic, approach.
they
And
do.
we have a more community approach.
Yeah, so
right?
Carl Jung was the one who talked about collective consciousness, right? I think it really
Okay.
does affect, because India here, we are a very communal community, and these are laws, you can say, or a certain principles that have been passed down from generation to generation. This is something that not only focuses on the external but the internal focus also, and how the pre-construct of a person is being handled in a child, right, in the developmental stages. You're always being trickled down, these principles are always being trickled down throughout your developmental stages. So we can't say it fully relates to us. Obviously, the psychological aspect of it, anatomy and everything.
Biological, it's quite relatable.
Yeah, quite relatable. Yeah.
But then social factors, I don't think
Of course, that's a oceans apart.
Yeah.
When you look at their lifestyle and social engagement or social engagement. So now from here, what I want to understand is who is more prone to mental problem and mental illness when it comes to a society that is has high social engagement like us, and them who has low social engagement, who are more individualistic?
See, what I feel is that if it's a community-based, we have an upper hand.
Okay.
Because we as human beings, we are social animals. So eventually, being social, we tend to have more of support from the community. It's not an individualistic approach, it's a community approach every time. So in one hand, we have the upper hand, I suppose. Yeah.
I look at it as each of our systems being at the opposite ends of a spectrum. So I think it's quite balanced out. So we might have a lot of support. So in the process of recovery, we will have that
Social
extra support.
Yeah.
Yeah. So recovery becomes a little more comfortable for us, a little more easier. So, and it's a little soothing also.
I'm sure,
The
it
recovery
plays a great role.
Yeah, because during the recovery process, the biosocial factors are very much important, isn't it?
Yeah. However, in their individualistic society, what I see is that they're able to ask for help at the right time. They're able to identify what they're going through.
I feel they're more aware.
Yeah, they're
that
more
has got-
aware.
Yeah.
So they ask for help at the right time. However, in a community-based society, it's like it's okay, chalega.
You'll
because
get.
I've had friends who texted me saying, I have this cousin who is going through this really depressive kind of. I see that depression is there, but the parents are saying eat lots and sleep. It will go away.
Yeah, don't be weak.
Yeah.
It has got to
Certain
do with a
things.
lot
So,
of, lack of awareness. That is what I would say.
So ends of the spectrum,
Yeah.
equally balanced out.
Because I
think.
can remember one patient of mine, actually. He has been diagnosed, since he was at the age of 7-8 years, he had this ADHD symptoms. That is what we call as attention hyperkinetic syndrome, right? Attention deficit hyperkinetic syndrome. So eventually in this, in this disorder, it is a neurodevelopmental disorder. So eventually he was intellectually very sound, right? But then because of this disorder, he has issues with attention, concentration. He is hypermobility is there. Then in a spot for
and
then
even
he'll
a few
have
seconds.
more of risky behaviors, indulging in risky behaviors.
Wow.
So those people, they have more prone to engaging in risk-taking behaviors. So eventually when he was very young, his parents didn't know. So our community, usually when a male child is being very naughty, moving around here and there, not sitting at one place, then they would say, yeah, he's a male child, right? Male child are supposed to be like that, isn't it? They're supposed to be naughty. So eventually his symptoms were, neglected because of lack of awareness. So eventually what happened, because of his, issues, he started self-medicating himself. Why? Because at a very young age, because he acted quite abnormal in front of his peers. So eventually they made fun of him. So he was bullied around. So eventually his parents didn't know his parents thought that it was normal, right? So eventually he started self-medicating himself, taking hormonal supplements, right? He wanted to make his, body healthy.
Come into that range, what we would normally classify as normal.
Yeah, that's
he wanted to fit in.
So he indulged himself in, harmful acts like addiction. So he started taking all psychostimulants, right? MDMA, ecstasy. Those are the things that we have. Cocaine, right? So because he was unaware. Even he was unaware. Even his parents were unaware. So because of all those issues, he started indulging in all these addictive substances. Now, because of all those, he's seeking for help. But now, after addiction, it's very hard, to get out of it.
The case has become even more complicated.
Yeah, because he...
I'm sure
with the addiction,
you would have probably first tackled with the addiction, right?
Yeah, addiction, then the depression.
Then the depression. Then she would have to then go for the ADHD. So she cannot tackle all at once. She will then have to start
one by one. So
treatments and all that.
Multifactorial are the ones that are very hard to treat, actually.
Then how do I know as a person that I may be suffering from mental illness? What will be the symptoms, basic symptoms that I should be, like as a person, we all should be careful about?
Okay. As we said, mental illness has got to do with our thought processing, right? And the behaviors, right? And our emotions. So when we feel like we have some dysregulation of emotions, or we are acting, what can we say? More
incoherent?
No.
Or I don't know.
Disgruntled, maybe?
Yeah, like we are not behaving ourselves. Unpredictable behavior, something like that. Because there are so many disorders, actually. So when we come to depression, when the patient is having continuous low mood for 2 weeks, 3 weeks, right?
Okay, low mood.
Yeah, low mood.
In other words, very gloomy emotions.
He's not feeling like himself. He doesn't feel like talking to people. He doesn't want to interact. Then he feels like either like sleeping all the time, or he can't even sleep at all, right? And then he doesn't feel like eating at all, right? He doesn't want to do the things that he used to love doing, right? So those are the symptoms that we can usually see in depression.
Wow.
Yeah, like as adults, I'm sure we have some semblance of who we are as a person.
Okay.
Right. We have some semblance of awareness of who we are as a person, as in who we are personally in our own personal space, who we are socially, who we are in public, setups as well. If you slowly start to see, certain traits that are hindering your productivity or the way you are in those settings, and that it is something that is not natural to the way you work in your environment, then I think it's a way of understanding, okay, I might be going through something. Okay. Maybe I should be seeking help, or just seeing if there's any issue that I need to get, sorted out, or just get help for.
Well, that's interesting, because some of the characteristics or symptoms that you have explained, I'm sure many people are suffering from those. And they will be locking themselves in the room for weeks or for days.
It's called self-isolation.
There are many people doing that. And those are very obvious. And you can see that the person is like unpredictable emotionally and in the way he or she expresses her joy, his sadness. It just takes a second to change the mood completely.
Yeah.
Of course.
Right? There's no constant or controlled, I would say controlled emotions. But control as in not with effort, but as in there's no continuous flow of seamless expressions of emotions like happiness or sadness. Some people, of course, there are times we're sad, there are times we're depressed.
Yeah, yes.
And the normal people, normal as in those who are not suffering mentally, I mean, like, there's a different reaction to what
there
how
will
they are,
be some level of coping.
Right.
Yeah, and day-to-day, daily stress is always there, right?
Right.
And then we go to sleep, and then it's back up again. We carry on with our day.
Right.
So, like, everyday stressors, we're able to take on the challenges. We're able to take on as well. However, if there is certain hindrances that are causing you to be unable to take on those challenges, and there are certain signs that you are now retracting away from things that you like to do, or people that you like to be with, and all that, and you're not interacting with your family also, or your friends, then maybe it's a thing. It's a cause for concern. Maybe you should look into it as well.
Wow. So I think a lot of external, now from what you share, I'm realizing that in our society, a lot of external factors are playing big role in, bringing or causing people to suffer from mental illness. A good amount of, external, social, whatever factors that you have.
Yeah, I mean, community.
Right?
It's very communal, so
Because there
expected.
is a benefit for being a very communitized society on one hand. On the other hand, there is also an equal amount of repercussions. Because since you're so communitized and so engaged with the people, whatever they feel about you, they think about you, becomes so important to you.
Of course, yeah.
In Western society, you may do some crazy things out there in the streets, but no one knows about you. No one cares. He won't feel the reaction of people's rejection. People will not talk about him. People will not reject him. But here, if you do something very, very bad and wrong, like, society will give you that stigma
pressure is,
forever,
of
and they will
course.
identify you with that.
Yeah.
That's I'm just realizing that as we converse.
And that is the reason why there is very less reporting of people who even suffer from mental illness.
Yes.
They don't report.
Yeah.
They don't even come seeking for help because of the same issue that you have just pointed out just
and
now.
lesser so are women asking for help in Nagaland. Yeah.
Less women
Ask for help.
Oh.
Here in Nagaland.
I think that has got to do a lot with the, as we have a very communal community, women use very good coping strategies. Like, I'm not...
I would agree with that. Women are stronger when it comes to coping
I
problems.
can't say stronger.
No, emotionally, they are stronger. Coping pain. I believe in that. I don't know.
I think it has got a lot to do with them being able to express their emotions more.
Yeah.
Right?
EQ,
so that
right?
is the
Expression,
reason why less in our society. That is what I feel.
Yeah.
Okay.
Right. But the men...
Men can't handle pain. Okay, either it's a mind pain or either it's heart pain or physical pain. Women can endure. Better than men.
EQ regulation and expression for men, usually it decreases when you hit adolescence, and then it just keeps decreasing until you reach adulthood.
Oh, that's interesting to know. I hope the men folk will take note of that.
I mean, it's okay to feel those emotions because every baby is born with, hunger, fear,
Thirst.
Yeah, those are, and the babies express those emotions. Otherwise, the mother won't be able to say if the baby's hungry, if there's something wrong with the baby,
Right.
So these emotions are natural. It's coming in from from the inside. So I think it should be expressed. So the more you bottle up,
Okay. Now it's getting clear, and I'm so glad about the thoughts that you share. It's very helpful. I mean, as someone like me also who have not read much about these things, we don't, read in details. We don't, dig deep on this issue or in this area. So, I mean, it's good to have a conversation like this and share your thoughts, experience. One thing I would like to still understand is when someone comes to you that I'm suffering from this, I'm so worried, I'm always anxious, I'm always worried, and I can't sleep properly, my appetite has reduced. What do you do to help? Like, you have to deal with the mind, right? So what do you do? Did you say, like, it's going to be okay, just relax?
No. Unfortunately, no.
So, like,
We can't
give
say
me a
that.
gist of what kind of counsel you give to people.
We just try to make them comfortable, first of all, right? And then we try to establish the rapport. And then after that, we try to, they just want someone to listen to them. That is what we have seen, right, in our
Yeah.
practice.
I'm sure every
Most of the
single
time, yeah.
Yeah, so eventually we
become
tend to
the-
listen to
yeah.
their, O's and whatever issues that they feel that they are facing in their, because there is a lot of catastrophizing that we have seen, right? In our patients usually. So eventually we try to analyze the situation. How are they getting affected if if their personal life is getting affected, if their social life is getting affected, if their their workspace is getting affected, then eventually assessing the situation, we just see if it's affecting all the three factors, then we usually tell them you might need some medications for the time being, but of course, because they need to strengthen their coping strategies, coping mechanisms. So we usually, as a psychiatrist, we usually tend to, refer them to the psychologist, for counseling sessions and all,
Right.
so that they can, because usually what we have seen is that it is because of the disruption of their coping mechanism, usually. That is what usually happens. So even with medications, if their coping mechanisms are, disrupted, right? If it's not taken care of, then they will eventually have a relapse again, even if they get better with medications. So eventually we try to assess during that session, we try to assess what is their core issue. And if we see that there is some issue within themselves or within the environment that they're living in, right? So eventually, accordingly, we assess the situation and then we do the treatment.
Oh, that's interesting.
Yeah,
Just before
so-
coming back to your side, I just want to add something that as a layman, I have heard people talking about when people are anxious, they're sometimes given medications, and people will just I myself will wonder why for mental health, for mind purpose, why do people need to take medicines? As a layman, we could not understand that. Now, you are saying that medication sometimes is required because, as we talked, there is a biological factor as well.
Of course, yeah.
And neurological factor, and all of this comes into this. So now it kind of makes a lot of sense to me also that, that's why people take sometimes medicines because of the factors that has really caused mental illness.
So when you take the medicine, it's mainly for the neurotransmitters also.
Yeah.
So to help balance it out also. So
Yeah, so whenever a patient comes, we usually don't give them medications.
Yeah.
As I said, I've mentioned earlier, we try to assess every aspect of their life. So if it's affecting, as I said, personal, social, and their work.
You have to do diagnostic work first, right?
Yeah,
Of course.
right. That
So
is,
we have that level of severity like Dr. Ayang mentioned earlier, right? So they will assess the patient's severity level and then they will deduce if medication is required for this case or not, and then we'll go forward like that for the treatment plan. So may dupay siya kung na may anxiety pa kung na-ayos siya ulit. It's not directly
Yeah.
medication.
Of course.
Yeah, it's about a 30-minute to a 45
minutes,
consultation. Yeah, with the doctor.
yeah.
So in a society like ours, I have personally seen people going to prayer center for sure. And whenever people suffer from addiction, whenever people suffer from sickness, I won't say everyone, but normally people get sent to a prayer center. And some people come out well, no doubt about it. But why do we need to send all the time to prayer center when there is a service, professional help? Just as we don't send people who are suffering from diabetes, to a prayer center because we go to a doctor. So don't you think it should be like that for mental illness as well?
Yeah, what I believe is it has got to do with our cultural beliefs, our cultural norms. Yeah, so I feel like spirituality is quite ingrained since old times in our society. So eventually, if something comes up that they cannot understand, as I said, I've mentioned earlier, because of lack of awareness, so the first thing that comes to them is, spiritual help, which of course, I'm not saying it's of less use. I'm saying, of course, it gives a holistic approach to the care that is needed, but then they usually, go towards that. So because of all those, the duration of illness gets prolonged, right? And eventually, what we have seen in our practice is that they usually present to us very late.
Okay.
Like they go to different prayer centers, they try to, seek healing from there, and then eventually from one to another. Then the duration of illness gets prolonged. And when they come to us, the patient's health has really deteriorated, actually. So eventually, it will lead to, the patient, the treatment gets prolonged.
Yeah.
So the more the duration of illness, the treatment process also prolongs.
Absolutely.
So, and usually what we have seen is that those patients, they cannot go back to their pre-morbid state after that, because of the prolonged duration of illness. So that is what we have seen in our this thing. But what can be done is that at least try to be aware of the symptoms, right? And know when to approach like a medical professional, and then incorporate both, our spiritual beliefs, plus the, the mental health care, like the new, the new mental health care facilities that we have in our society, in our state, making use of both can give a holistic approach, and in the same way will be good for the patient's recovery. That is what I feel.
Absolutely.
Yeah, I think I just want to add that, awareness, not that great here in Nagaland. And I think that, though, in some capacity, as mental health care professionals, we're also failing for the awareness part.
Okay.
Yeah, I think we should, put the pedal to the metal and, start with the awareness and all that, so that the individuals can also identify, that this person now needs medical attention.
Yeah.
That will really help bridge the gap between, the time of treatment, counseling, and also recovery. And our main focus is, patient care, mental health patient care, right? Yeah. So we want to bridge the gap as much as possible. We want to, reduce the gap as much as possible. Telemanas is one step, DMHPs are another step. State Mental Health Institute is also, starting to develop a little bit. So that's also another thing. But then awareness. So awareness needs to be facilitated in a very massive scale, so that people are at least able to identify, this person does really need medical attention.
Right.
And then once the medical treatment, care is provided, counseling is provided, then maybe head on for the religious, to facilitate the religious care as well, because it's very important for us as a community. It's one aspect, spiritualism, one aspect is you speak to God in your own personal space. So you don't have to be anything else.
You don't have to really go there.
Yeah. So you're just you, right?
Yeah.
So it's a part of releasing, the negative energy also, and then the negative emotions also. So prayer is a way of releasing that as well. So it's okay. It's good.
Absolutely.
So, but then
Ventilation.
Ventilation, right? So it's very important that we start bridging the gap, making sure that the treatment is taken in the right, course, duration, so that, all the coping strategies are given, awareness is provided as well, and then in case of, reoccurrence, the client also knows what to do also. Right.
Adding to that, I would like to add,
Please, close.
Yeah, sorry. What we have seen is that because of lack of awareness and because of stigma that has got to do with mental illness, patients usually present with us with somatic complaints. That is like, I have a headache.
Physical
ailments.
complaints,
That is what they
ailments.
usually come. Or else they're being, referred from the prayer center, or they are being referred by some medicine doctor. So eventually, there are very less people who usually come to us directly. They're being redirected by someone or the other.
Okay.
Yeah, so I think that has got to do with a lot of, lack of awareness, the stigma that has got to do with the mental illness, right? So all this combining, I feel it has,
I think,
adds up to everything.
absolutely. I think that's the way to go. I mean, we are not, people should not misconstrue that, we are totally objecting or rejecting the idea of prayer. Just as we go to a hospital to do a kidney checkup, like we should come to a professional psychiatrist, counselor for mental health. And, even though we go to a hospital for other health checkup, we pray. We do the same.
Yeah.
So like what we're urging is people is, okay, fine. You continue to pray as you do, but still also come and talk to the professionals who understand the subject, who understand the illness, right? I think that's all we ask for.
Yeah.
I think people should not misconstrue. And sensitization part, I think, let's say this is going to be the starting of it.
This is a part.
Yeah, this is a part. And
we're really grateful for this opportunity.
yes, I think Telemana should pay us for this,
Maybe.
right? Someday.
We'll talk to the authorities. We'll talk off screen.
I'm really happy that in our society like this, we have service now. We have professionals like you all who understand the nuances of sickness now, mental sickness. I mean, 10 years ago or 15, 20, 30 years ago, I cannot imagine having people who understand, the details of mental illness and mental problems and all. I mean, we would all say, like, don't be weak. Just go out with your friends and enjoy. Why do you have to sit all the time in your room thinking about overthinking?
Of course.
We make joke about overthinking. I'm an overthinking person. But actually, there is something the reason behind why people overthink and, get hurt. I mean, internally. It's very interesting.
Yeah, it is.
It's thought processes, different ways of, like I said, translating that information that you're getting from the environment and how you're breaking it down. A lot of factors come into play again. How the principles of your community have constructed the way you think. Then your own education level and how much you've learned as well. And if you are broadening your horizon or not.
Right.
And then all of that come into play, and then sometimes it can lead to understanding the concept and just saying, okay, like I think I get it, but then it can lead to microanalyzing also, right? So it's, again, different ends of the spectrum again. So if it does not hamper, your everyday activities, it does not hamper how you're processing your day, then I think it's thinking or analyzing, microanalyzing is also a good trait, because you then tend to hyper-focus on things that need to, get sorted, and then you go and do it.
True.
Right? So I think it's a good trait. However, if it is hampering your daily processes, then I think there you need to at least get some therapy or, come and find help. Right?
No, I have one question. Suppose a person does, like a particular person doesn't have a background of trauma or background of any traumatic experience, and he has also good environment, and he doesn't suffer from mental illness, for example. But due to work stresses from the work, can that also become a cause for mental illness, that he can, finally fall into the trap, or let's say into mental health problems?
We do see some cases like that.
Yeah.
Doesn't have to be genetically or chronic.
Nothing
exactly
like that,
as you described it. We do see some cases of that manner as well. Yeah, because when life has been so stable and it has been going gradually, at a certain pace, and you're getting comfortable there, and maybe lucky for you that you have not faced any trauma or any kind of difficulties in life. However, again, it becomes an issue of if there is even a little bit of stress, then unstable. It becomes unstable for you. The environment, and then the output of emotion becomes unstable. So then again, there becomes an issue there, right? So for that, I think I would usually suggest take on challenges. More challenges. If you keep challenging, taking on challenges that you think, okay, maybe I might not be able to do it, but then you go ahead and try and do it, then you start to develop those coping strategies also, and then those coping mechanisms.
It gets stronger.
That's self-help.
Okay.
And in the long run, that's much better than having a problem later on and then coming and seeking help also, right?
True. Wow. So I think it has been a very engaging plus meaningful conversation, and we have talked for quite long. And I think we can definitely talk about this for, let's say, second session also, other time. But this topic itself is so huge that we cannot cover everything.
Yeah.
But I'm so glad that there is a service, there's a helpline that exists in the state to help the people from the state. And I'm very happy about it.
Yeah.
So whoever is watching this episode, I would really definitely like to request that in case you're suffering and you're not able to handle yourself, you're always worried and you're always anxious and you can't sleep, just do not feel hesitant to contact this Tele Manas.
Yeah,
and we will provide the phone number below. And just reach out and have a conversation and get yourself diagnosed. And then you will get help from them, definitely. And we are not doing this for promotion, but we would like to shout out a service, very excellent service like this, with excellent and very professional people, and who are very experienced and who know and understand the subject very, very well. So I thank you both for coming on my show to share your thoughts and experience.
Yeah.
If time permits, I look forward to doing this again very soon.
Sure.
Thank you so much.
Sure. Thank you.